So today, as happens 2 or 3 times a week, I got an email inviting me to a conference on mental health in the workplace. And the focus was on making it easier for people to access care and making sure that there are communications throughout our organizations about the resources that are available. I've been in this field of trying to create mentally healthy workplaces where people experience great well-being for well over 20 years. And for at least the last 10 or so of them, there's been a great emphasis on mental health. But there's a piece that's always missing. And that piece is a focus on the experience of being in your particular workplace. Because your work experience, the experience of working in your company or your organization, is either supporting and promoting your well-being, your overall well-being, or it is challenging it. And that is the crux of the matter. And it's great that there's focus on resources and communications about what's available and efforts to break stigma. But what is crucial is this experience of being in your particular work organization. And so I think that it's important for employees to be asked questions like, does my workplace, the experience of being there, does it better and support my overall experience of well-being, or does it erode my overall experience of well-being? Because it's got to be one or the other. And then they should be asked, what are the factors that are contributing to that experience? To what extent does it include the relationship with your supervisor? To what extent does it include the pressures on productivity? To what extent does it include the autonomy that you have? To what extent does it include the extent to which and the regularity within which you are given appropriate recognition for the work that you do? And it's like the 500-pound gorilla in the room. And I think that this is not focused on for a few reasons. These are my hypotheses. One of them is that by the time people are at a level in an organization where they're deciding upon the focus of pieces of conferences like the ones that I'm invited to participate in, they are generally feeling at a place where they have more autonomy in their role, and they can have some flexibility, and they can create a meaningful, purposeful experience at work. And so they're not thinking so much about those issues because they've gotten to a place where they've got a lot of this good stuff going on. But that may very well not be the case as you cascade through the organization. I also think that the profit motive for our organizations exerts an enormous amount of pressure. And so it's very hard for many supervisors to create an experience that promotes well-being when they're always being pressured to get more productivity out of the people who comprise their teams. And finally, I think it's just an issue of people in management who are simply not skilled. Most people become leaders of people in organizations because it was the next step up. And they may or may not have the skills and the aptitude that will help them to be empathic and understanding and doing all the things that excellent leaders need to do. So there's a lot of emphasis on things that are important: access to care, breaking stigma. But the main issue is, what does it feel like to be in your workplace? And I just think there's a lot of room here for working on this, because the stats, the results of all the work that's been done to try to better our workplaces in terms of the experience of well-being there are not good. The results are not good. So there's something missing.